On the issue of the Sputnik V vaccine, it is indeed true that it has received emergency use authorization by our Pharmacy Poisons Board. In fact, it has received emergency use authorization from 65 countries and is in use in these countries already. In our case, we've gone further. We've set up another additional criteria that requires that we regulate the use of this Sputnik V vaccine. We are currently in the process of setting up this criteria with the private sector to ensure that we have a framework of engagement that will be agile, a framework of engagement that will be accountable for the use of this vaccine. Further to this, the ministry will monitor any emerging concerns or adverse events after immunization and be able to take corrective action when these measures are identified. The distributors have had several engagements with ourselves, and we've been able to work on this framework. We will soon be finalizing on this framework in collaboration with PPB and Kenya Medical Practitioners and Dentists Council. We shall soon be able to publish a list of vaccination posts where you can get this vaccine. In terms of our COVID-19 statistics, 1,412 people have tested positive for the disease from a sample size of 9,219 tested within the last 24 hours. Our positivity rate stands at 15.3%. Of these people, 1,324 are Kenyans, while 88 are foreigners. In terms of disaggregation by sex, 771 are male, while 641 are female. The youngest is an 8-year-old month infant, and the oldest is 94. In terms of the current cumulative load of positive cases, we have 134,058 cases so far in the country. When we look at our recoveries today, 389 patients have recovered from the disease, 230 from home-based isolation care, 159 from various health facilities. Total recoveries now stand at 92,679. And we continue to thank our healthcare workers for the good job that they're doing. On a sad note, 6 deaths have been reported in the last 24 hours. 3 of them occurred in the last 24 hours, while 3 are late death reports from our facility record audits in terms of the diverse dates given. This now pushes our cumulative number of fatalities to 2,153, and we extend our sincere condolences to the families and friends, those who've lost their loved ones. At this juncture, I'd like to invite Ambassador Jaffer to come give a few words in terms of our collaboration and our friendship with Iran. Karibu, Ambassador.
Thank you. Honorable Dr. Mercy Mwangangi, ladies and gentlemen present, good afternoon to all of you. Is it working? As the world continues to fight against COVID-19, the Islamic Republic of Iran wishes to applaud the good work initiated by the Ministry of Health under the leadership of Cabinet Secretary Senator Mutahi Kagwe in curbing the spread of deadly virus in Kenya. I personally want to salute the healthcare workers for heroically putting their lives at risk in order to save our lives. I also want to honor all those on the front line for their heroism to ensure that the bigger part of our population stays safe and sound. We should all jointly commit to ensuring Kenya combats COVID-19 and restore the economy back in House of Innovation and Technology in Nairobi, Iran National Innovation Fund, as one of the empowering entities for startups and tech-based firms in Iran, presents these kind of equipments and materials has been achieved by the country in the last 42 years, despite being under illegal sanction. It is my prayer that this assistance package gifted by my country could pave the way for further diplomacy and result in diminishing pain, promoting peace and facilitating ways towards a better future for both countries. This package includes all made-in-Iran items such as ventilator, COVID-19 diagnostic kits, pulse oximeters, National Innovation Fund, and is presented to you as one Iran's goodwill friends. God bless Kenya. God bless Iran. Thank you.
Thank you so much, Ambassador, that very act. There is an issue again that we've had reports that people are charging for the vaccine. The AstraZeneca vaccine that is available in all public health facilities is there for free. There is no cost to that vaccine. There is no cost for you to be registered into the platform. There is no cost for you to be able to access that vaccine. The vaccine is available for free. I repeat, the vaccine is available for free in the facilities, and this includes private facilities as well. I think the other issue that has come through, Dr. Akwale, is the issue on the chanjo system. We have people sending us messages, waiting for their message. Perhaps, Dr. Akwale, you can clarify on this issue.
Yeah, thank you, Kasmongangi. The chanjo system was developed to ensure there is personal protection of personal data. It was done with very close collaboration with the Ministry of ICT and the ICT Authority. The system is working. However, there's been an increase in the number of people presenting in facilities, and therefore some of them are being registered manually. And what we've now done is we've enlisted data clerks who will now start supporting the entry of those vaccinated into the system. And once it is entered, then you'll get your alert. Thank you.
Thank you, Daktari. And so it is important for members of the public to note, if you've not received your message, we have your data. We are manually recording that data, and you will soon be able to receive your message. And so there's no cause for worry, fear, or alarm. I think the other issue that requires clarification, perhaps a bit further, is on the Sputnik 5 vaccine. One, we've had lots and lots of questions. We've seen reports in the media as to what the position is on this. And the first thing is that, yes, indeed, we have this vaccine available in the country. Number two, the vaccine has received emergency use authorization by PPB. Number three, we have been able to engage the distributors to identify the facilities that will be able to offer this vaccine. Right now, we are finalizing on this list of facilities, and once final, we shall share with you which facilities will be able to, offer the Sputnik 5 vaccine. We also have updates on this from the task force, so I'll invite Dr. Akwale to add in more information.
Yeah, thank you very much, Kasmongangi. I'll build on what you've said, that this vaccine, Sputnik V or 5, has received emergency use authorization, but not market authorization. And we need to clarify that. So under the Pharmacy and Poisons Board regulation, where there are certain conditions you need to meet when you are under emergency use authorization. And some of them that are not allowed includes marketing. You cannot market a product that is not yet approved for commercial use. This morning, the task force met, and the pharmacy board, which sits there, informed us that they have already summoned the distributors of this particular vaccine, and they have actually given them a warning in writing. And if that kind of marketing continues, there will be in contravention of the pharmacy board rules, and therefore that vaccine, the emergency use authorization can be withdrawn. Now, let me then also say, as a task force, we are looking at the broader picture of public sector participation. The government alone will not be able to meet all the needs of the vaccine during this time of the pandemic. And we are working on a framework that will guide the private sector participation fully. We've made certain recommendations. Among them, the vaccines that will be deployed in this country will require stringent regulatory authority approval. The stringent regulatory authority, one of them is the World Health Organization, the US FDA, the Swiss Medic, the British MHSA, and I think there's the EMA, European Medicines Agency. Now, in addition to that, it must have local registration with our Pharmacy and Poisons Board. In view of the current shortage of vaccines globally, and to be sure that we can start getting some of the vaccines that are still undergoing review, we've recommended that those that have submitted dossier to WHO, like the Sputnik had, and it is still undergoing reviews, can be allowed to bring in the vaccine. So that is a clarification I needed to make. Now, the second thing is that when importing these vaccines, it will be a requirement that the batch numbers are shared well in advance before they are imported into the country. Batch numbers must be declared well in advance to the Pharmacy Board before the issuance of import permit. Now, the other recommendation is that all private sector vaccines will have to report through the Chanjo KE system, which also monitors the side effects, so that we must know which vaccine, which batch number, and who was vaccinated. In addition, that is the only system that will allow you to get a certificate. So if you are not vaccinated through that system, don't come and ask for your vaccination certificate. In addition, the Kenya Medical Practitioners and Dentists Council must clear and approve the list of facilities that will be offering that vaccination. So we've just actually ended a meeting with the private sector. We've given them those conditions, and we are hoping, especially for Sputnik, in the next 1 week, all the facilities that are accredited by the Medical Council and therefore approved to give the vaccine will then be made available. Finally, we have also considered, and of course we take with a lot of concern, the issue of marketing. What we have resolved and recommended, if a facility is dealing with private sector vaccines, it will not be issued with the free public health sector vaccines. So there will be no dual, because there will be a conflict there. So you will choose, either you support government efforts to give the no-cost vaccine, or you go into the business that you know best. Thank you.
Thank you so much, Dr. Okwale. And I think for today, the last FAQ, I've received lots and lots of questions from members of the public. When can I receive the COVID vaccine if I tested positive recently? So by way of example, if you tested positive for COVID, say in February, are you eligible for the COVID vaccine that we are offering? And this is the answer that we have to this. We've engaged with the technical teams, and right now, what is recommended is that you can receive your COVID vaccine only after a period of 1 month, but contingent on clinician review. And this is important. I know previously we've mentioned here a period of 6 months, but particularly those who are over the 58 years of age bracket. We're getting lots of questions. I recovered from COVID in January. Can I now come and get my vaccine? And the answer is this. After 1 month of recovery, it may be safe, but only after a clinician has cleared you and has determined that you're eligible for getting the COVID vaccine. And so those who are in the vaccination points, it's important you relay this information to clients, because we've received lots and lots of questions with regards to eligibility to take the COVID Shield vaccine. I think at this point now I'll welcome Purity to start with the first question.
Thank you. Good afternoon to you. Purity Museo from KBC. Let me begin with the AstraZeneca vaccine. We've seen some countries We've seen some countries trying to withdraw the use of the AstraZeneca vaccine from reasons, side effects such as blood clots are seen in people who've received the vaccine. Maybe you can tell us, do we have, from the people that have been vaccinated so far, do we have cases of these side effects, the adverse? Then is there science behind the long-term complications for the AstraZeneca vaccine? Then on the Sputnik vaccine, earlier this week, Dr. Mercy, I'm glad you're here. You had said that the Minister of Health had not considered using the Sputnik vaccine, but it has been approved by the PPB board. Now, my question would be, were there reservations? Were there some of the things that you had noted with this vaccine that the ministry had decided not to approve its use in the country? Again, the Russian embassy yesterday did say that the vaccine was only imported by a private company. Which company is this? Did this company follow the guidelines that Dr. Willis has just mentioned? And if not, what is going to happen? Because there are Kenyans who have already come out to say that they have received the jab. Thank you.
Ben Kirira from K24 Television, and I have two questions. One is we have seen clips, or rather photographs of dump site collectors donned in PPEs. We'd like to know what is the disposal protocol and how did this particular product end up in a dump site. The second question is on the Sputnik vaccine. We'd like to know how soon will it be available to Kenyans, and in case Kenyans tend to, lean towards that side particularly, are you, as a government, looking to change your procurement process for the AstraZeneca vaccine? Thank you.
My name is Dorcas Wangira from Citizen TV. I have a follow-up question, and one, the conversation today has been on unlock our country. And many Kenyans are saying that with the current economic situation, how long will this situation persist? And wanting to hear just the voices from the ministry which advises the president. And then the second question is still a follow-up on this Sputnik 5. Already there are clinics that have administered the vaccine. Yesterday we saw prominent lawyers saying that they have received the vaccine. So will it be legal for any Kenyan to just walk into the clinics that are already giving this vaccine and getting it? And Dr. Akwale has mentioned that there are other vaccines which are undergoing review. Could you mention which ones these are?
Zainab Mohammed, TV47. Yesterday, PS Mochache mentioned that the second batches of COVID-19 vaccine, the AstraZeneca, that we're expecting in either April or May, there would be a delay due to India halting the distribution internationally. So my question is, how will this affect those people who have already received the jab? Could this delay the second dose, the administration of the second dose to those people who have received? Thank you.
My name is Chebet Birir from KTN. My question still is on the Sputnik 5 vaccine. With regard to government informing Kenyans when it was brought in, the question is, why didn't the government inform Kenyans the moment the vaccine got into the country? And then how efficient is it in terms of percentage? Thank you.
Thank you. Thank you for your questions. I think what we'll do is we'll first deal with the Sputnik issue. So we do have a question with, were there any reservations in the approval process for Sputnik? We have a second question of why were you not informed when Sputnik came in? We have a question on who has brought in Sputnik. We have a question on, is Sputnik better than what we have? And this is the response to those questions that touch on Sputnik. One, by the time we were engaging and rolling out our vaccine deployment plan, it was absolutely clear that we required private sector engagement to be able to get to the sweet number of at least 60% of Kenyans having been vaccinated. And so at the outset, the principle remains that we encourage private sector collaboration, and this was welcome. Now, for these agencies to be able to give the requisite approvals for any private vaccine to come into the country, Dr. Akwale has shared with us today that the vaccine must have received the requisite approvals when you look at stringent regulatory authorities. of which WHO is one of them, and he's mentioned all the other SRAs that exist. But in terms of the Sputnik 5 vaccine, this vaccine is already in use in close to 60 countries, and by the time it was here, what needed to be done is to develop a framework in terms of how we shall be able to roll this out, and that is a framework that we're telling you we're currently finalizing. And when we finalize this framework, we shall then be able to share with you a list of where you can access this vaccine. In terms of the efficacy of this vaccine, it's important that we all understand, not just for Sputnik, not just for AstraZeneca, not just for Moderna or Pfizer or J&J, that to date, there has been no scientific study that has compared Sputnik versus Astra versus Pfizer versus Moderna. And so the numbers that we've been sharing with you when it comes to efficacy are numbers that have come about from independent studies that have been carried in the different regions or geographies where the trials have been done. But as it stands today, no vaccine has been compared against another. And so even as we stand here today, we cannot tell you that Sputnik is better than Astra or any other way around. And that's important for members to understand. We're receiving lots of questions. Is Sputnik better than Astra? And right now, that answer is not available here in Kenya, neither is it available across the world. The answers that are available are that the vaccines that we allow for you to receive will be vaccines that are safe, vaccines that have met the minimum threshold for a vaccine to have an effect, which is about 50 to 60%, and vaccines that we've noted actually have that power of prevention against severe disease. One of the important matrices when you're evaluating a vaccine is actually if this vaccine prevents you from getting to an ICU bed. And I want us to be very clear on this. All the vaccines that we shall allow within the country, all the vaccines, be it Moderna, be it Pfizer, be it AstraZeneca, be it Sputnik, are all ending at the same endpoint, which is preventing progression to severe disease. And therefore, that is the only matrix of comparison that we have. And because when you use that matrix, it means really, at the end of the day, scientifically, they're all at par. And I want us to understand that. I think, Dr. Akwale, you can add in.
Yeah, thank you. You've actually explained it well. And I would summarize this way. The primary endpoint on the effectiveness of a vaccine for the COVID virus disease is prevention of severe disease and death. And all the vaccines now approved, especially by WHO, are 100%. The figures you see, 60, 70, is a lot more epidemiological determinants on how you reduce transmission within a community. This must always be considered in several fronts. Some of these vaccines were maybe assessed at a time a country had already flattened its curve. And then you can attribute that just to the vaccine. There may have been many dynamics. As you know, like now for us, January and February, we didn't have many cases. So if somebody was vaccinating that time, he may say, my vaccine did that. And then another one is assessed when you have high transmission. So that usually becomes what we want to say a debate among people looking at the epidemiology. But for Kenyans, for the moment, our keen interest is to reduce death. And the task force has recommended that we now want to monitor the number of admission, and we ask ourselves, who among them was vaccinated and who was not vaccinated, so that we see the impact of the vaccines that we are deploying.
Thank you, Dr. Akwale. I think the other issue on Sputnik is the statement that was released by the Russian embassy. And in terms of who brought in the Sputnik 5 vaccine, we do have a licensed distributor who brought in this vaccine into the country. And the mechanisms in terms of bringing it in were followed, as we've shared with you. What was missing and what you've had missing really particularly comes into the sector of how do we engage private sector to ensure indemnity is in place. That was the key cog in the wheel, and that has soon been sorted. And what this means is that should there be an adverse reaction in you receiving that vaccine, that the distributors shall then, of course, take up the costs and the indemnification related to that. And that now has been cleared. In terms of those facilities, like I said, we will share that list with you once that is finalized. I think the other key question that has been raised is the delays from India. Indeed, we've seen statements. We've received communication that there could be a probable delay, perhaps just a delay of 3 to 4 weeks. So far, we are not worried about this delay. We are confident that when it is time for you to receive your second dose, you shall receive it. It's important to note that the window for you receiving your second dose is between 8 to 12 weeks. And so once we are able to unclog the supply chain issues that have now presented themselves, you can stand assured that within that period of 8 to 12 weeks, you shall be able to receive your second dose. Again, Dr. Akwale, I invite you to add on to this.
Yes, you are very right. And the delay, the communication we have so far, the delay may be about a month. We expected it early April. So we should get in early May. And at that time, many people will be already ready for their second dose. We are making arrangements. You remember we started slow. So the demand for the second dose in the early weeks will not be much. And at that time, then, the COVAX mechanism should be able to deliver vaccines. Let me add at this point, because you asked a question about other vaccines. Yes, we are in discussions with other vaccines that have already got approvals. Johnson & Johnson is one of them that we are looking at, but we are also looking at Pfizer and Moderna as long as the vaccines become available. And we're also looking at the private sector, especially those that have got that full approval, to consider getting them to the country.
Now, the other last two questions on how long shall this situation persist. One, like we've always said, we do have a technical task force. In fact, the task force is meeting tomorrow at 2 o'clock. And when it meets, it shall review the current COVID-19 situation in the 5 counties. We shall examine the different matrices that we utilize in determining whether the situation is getting any better or any worse. And so by way of answer today, when will this end? We do not know until we review the incoming data and until you, the Kenyan, takes personal responsibility to actually protect yourself and your community. And so remembering the 3 measures still remain: hand washing, social distancing, and masking remain. I think the other last question would be on the dump site, and I'll be asking Dr. Kefa to comment on this. That information did come to our attention, and PPEs are classified as highly infectious waste. And so we do have a protocol, and Dr. Kefa, you can share our waste management protocol.
Thank you, it's true, we have a protocol on that. Indeed, we got the information, and the action has already been taken this morning. All the counties have been informed, and we also want to request those people who are owning the hospitals or our colleagues, let us take care of the waste.
Thank you, Kefa. At this point, allow us to move to the receiving ceremony. And any other questions, please just hand them over to Mutua. We'll be able to give you answers. So let's move over to the handover ceremony.
Kameme TV, muthegi wa ruriri. Kuma riũa rĩkĩratha
tukarora Kirinyaga tugathathaiya nyene ni undu wa gutuhe muthenya mweru.